And I would also respond that what the Trump administration is doing by releasing some of the overreach from the federal government on those small businesses, it has created some equilibrium to any hurt that small businesses may be feeling. So this is something that we can do for the long run, though, is undo the pain of the pressure from some of these regulations that are fine for larger corporations, but certainly do hurt those smaller businesses. So I appreciate that. And I would also recommend that the members of the committee also should be the ones advocating for their small businesses and reaching out. If they feel that there is a concern from small businesses, they should take that to the administration. So I know I certainly do. I have those conversations with the president and the administration. And Senator Booker, thank you so much. If you would go ahead and direct your questions to the witness, you are recognized for 5 minutes.
Chairwoman, I really appreciate you. Thank you for having this hearing, give us an opportunity to have a conversation. Mr. Relgan, I crisscross my state and really am interested in the success of small businesses, who are the top job givers in our state and job providers. It's extraordinary to see these entrepreneurs who risk their capital and make serious investments in not just the success of their businesses, but as you know, small businesses radiate into our communities, or are part of the fabric of our towns, especially a state like New Jersey, which runs on our small towns. One of my biggest concerns I hear from my small businesses right now is just healthcare. They're getting really stuck pretty badly with healthcare costs. And we just enacted, Congress did, sweeping cuts to the federal healthcare funding programs, and has really given tax cuts not to some of the small businesses, but seen a lot of them inure to the benefit of the wealthiest there were. And so the CBO, which is a nonpartisan congressional budget office, as you know, estimates the healthcare provisions in that bill will increase our deficit by $907 billion from 2025 to 2034, and the increases the number of uninsured Americans by 10 million by 2034. An additional 4.2 million will lose their marketplace coverage because the law failed to extend the tax credit enhancements, which lower annual premiums by more than $700 on average for people who receive them. Simultaneously, the small businesses with the Affordable Care Act are facing premium increases of about, on average, 11% for 2026, according to an analysis of preliminary rate filings from 318 insurers across all 50 states. And so when I just finished crisscrossing my state, having town halls, I was stunned. I thought we were going to be talking about other issues, but small business after small business talked to me about literally the impossibility of covering health care, or even imagining trying to cover it for people to work for. I had one woman who has a flower business in my state who talked about not only will she have to forego health insurance, her and her husband, in order to keep it for their children, but having the challenges also of watching their employees who get it through the marketplace have to lose their insurance as well. So as an administration finalizes its regulations for the Trump tax bill, will you advocate for the small business owners whose prices are going up due to the administration's economic policies, or who will actually lose valuable employees, as some of the owners told me, that are going to go to places where they're going to get health coverage because they can no longer afford it themselves?
Thank you for your question. The short answer is yes, I listen to the small businesses, and then I report what I hear to those who make the rules, and around healthcare in this case. And like you, I hear a lot, and my staff hears a lot about healthcare. We have a letter on our website where we've gathered together, my count was 97 different healthcare issues that we heard about from small businesses. And the cost of insurance is something that's often cited. One thing that's often cited is the pandemic emergency. We hear in so many different ways that rules that were put in place during the pandemic are still there. And the pandemic emergency doesn't end. And that really undermines a number of healthcare
yeah, I'm going to interrupt you here because I got 90 seconds. So I get it. As a former mayor, the bureaucracy, the rules, all of these things, this is where I find a lot of agreement with my colleagues on the other side of the aisle. But the biggest issue, and I'm not overstating this at all, was the staggering premium cost, the staggering cost of people's health care. And you said, yes, I'll advocate for that, but I'm wondering specifically, when you're saying on your own website, I think that you were mentioning, you're having people bring this problem. I'm asking you then, what is the solution? What will you be specifically advocating for to deal with the number one issue, and it's anecdotal, but that I heard in county after county of New Jersey, meeting with small business people, thinking I was going to talk about other issues, but every conversation centered around this staggering cost of healthcare. And I'm wondering, you as a person that's in a very important position, what specifically is the solution as you see it to that?
Thank you for your question. We have 97 specifics in the letter, but if I were to organize them, as we did in the beginning of that letter, really the Regulatory Flexibility Act principles apply very well to those 97, which is there are a lot of regulations that reduce competition in healthcare. And I mentioned in my opening statement things that increase the cost of healthcare by undermining independent physicians. And the other aspect is wasted resources. That to deliver the same healthcare, we need more resources because of all the red tape.
And have you thought about the consequences? Because the immediacy of this starts at the end of the year. What are the consequences going to be for small businesses that see their costs going up tens of thousands of dollars, not being able to cover their families, or facing employees who are leaving? Have you thought about, because to me it seems like quite the tsunami that's about to hit small businesses with their costs going up 5%, 10%, 15% just for health insurance alone?
What we have been doing in my office, and I've been doing myself, is again listening to what the small businesses have to say and the problems that they express.
But you have no immediate solution in your mind for in January.
Well, I have 97 solutions that I heard from the small businesses. They're not from Casey Mulligan. They're from the small businesses. Some of them are immediate, and others may take more time.
Thank you, Mr. Chairman.
Yes, thank you, Senator Booker. And I would say, as you pointed out, there are steep premium increases. So just simply allowing subsidies to continue to flow doesn't bring the cost of healthcare down. So I think this is something we all should be able to work on together, is figure out what is going on in healthcare that's driving those costs up, and how do we actually lower the cost of the healthcare so that it's just not significant premiums. So I hope that we all can come together and figure that out, because yes, our small businesses need an option that is affordable and allows easy access to health care. So thank you. God bless you. And Senator